Medical Tourism Corporation interview with Dr. Suryanarayanan, Orthopedic Surgeon, India. Extensive India and international education and experience. Expert at primary and revision joint replacements.
I'm Dr. Suryanarayanan, basically an orthopedic surgeon, in practice for now almost about 20 years. Previously, in the initial times, my focus of interest was largely trauma, complex trauma and spine. But at this point, in the last 12-14 years, I'm with the reconstructive joint surgeries. The focus for me is also the revisional surgeries, because replacements have been performed for the last 10 to 15 years, 20 years, in increasingly higher numbers. So we find the old people, the previous patients, coming back for revisions. So that constitutes almost 30% of the practice. Basically, I trained from the University of Bombay. That's where I did my graduate studies and postgraduate studies, and got my master's degree in orthopedics. But subsequently, specialty training was mainly fellowships. In joint replacement surgery, I did my fellowship stints at the Hospital for Special Surgery in New York City. That was basically a center very reputed for hip and knee replacements. This was way back in the early 90s. Then I spent some time with the hip unit at Bern, that is in Switzerland, which is another famous center, which is called the Maurice Muller Center. And the other place I spent a considerable period of time was in Germany, which was another hip knee center, which was near Nuremberg. It is called the Wagner Clinic. But besides, these were the three major things, and of course my other stint has been in Hong Kong with the Chinese University. Basically, my focus there was the bone banking and the use of bank bone, which we have started in our own way in this place. Because the more revision surgeries you do, the more you find the need for bank bone, because the volume of bone destruction is so much. So this was led to collate. But in the last 5-6 years, 8 to 9 years, it's been mostly not long fellowship travels, but it's basically visitations to major centers. Either it's maybe Australia, like from yesterday I'm back from Japan for this morning. So we do it twice, thrice a year just to keep abreast of what's happening, and it's a good exchange of information. That's what is happening. For the international patients, my main highest on this is the knee replacements, both total knees and unicondylar knees, which is basically, to put it in the layman's term, which is a partial knee sort of a thing. Maybe about 15% of the patients qualify for this unicondylar surgeries when the damage is restricted to one half of the joint, usually on the inner side, and you are able to trade time. This is a procedure which has been sort of a little, not so popular, I know, in the United States, but it is highly popular in the continent Europe, and they have done well. So this is my preference too, wherever feasible, because for two reasons. This procedure preserves the entire function, and it's sort of, why take off something which is not damaged till now? That's my philosophy. So we can always convert. So that's one. And then second is, from the African side and from the Middle Eastern side, we do a lot of revision hips and knee surgeries. We have also adhered to and sort of changed our systems. Like the operating theatre, operating room is a laminar airflow theatre, which is sort of a world standard, where we have got a fair flow of air exchange. So that is trying to minimize. We do, just to be putting the long story short, probably personally do about 300 procedures a year, 300 to 350 replacement procedures spread across hips, knees, and other procedures. We are running at less than 1%, 0.5% infection.
Medical Tourism Corporation facilitates affordable medical treatment at world-class international hospitals. Fill out the estimate request form on our site for a free quote and more information.